Clint Wallace, you are just now getting off a very long overnight shift. How are you feeling right now?
Tired.
What is your biggest concern right now as an ICU nurse?
My biggest concern is the amount of energy that our staff has spent at the hospital. We are exhausted. We are tired. We are near burnout, if not already burnt out. It's been that difficult these last 8 months. I think some of them want to just scream out of the top of their heads, like, what is going on? Why can't we just stop this?
You mentioned COVID patients require a bit more attention, a bit more energy. Can you kind of specifically explain what that entails?
At Sacred Heart, we wear, the gloves. We do double glove. We wear a disposable gown, and also either some type of mask, whether it's a PAPR or an N95 and a face shield. So to put all that on, just to go into a room, takes some time. You spend the time with the patient, and then you want to go see another patient. You have to take all that off, leave the room, get your supplies, put all that back on, go into another room.
What would you say are maybe some of the most common complaints or concerns among ICU nurse staff?
Well, it's been very difficult because part of a patient's rehab, or even if it's their end of life, they need some family support. And with COVID, the ICU patients have not been able to get that. And that's been very difficult on staff to see patients alone, to not be able to visit with their family.
Do you have an idea of how many patients you've lost to COVID so far?
Just last week, we saw 10-ish, I'm not sure exactly, deaths. And that's a lot, especially just for one virus. That's a substantial amount of people passing away. And unfortunately, we also see it within families or within friendships that it's clear that one of them gave it to the other person, whether it's the mother gave it to mother gave it to their daughter and they both got sick, or two friends who spent time together and they both have it.
That can't be easy because at the end of the day, you're still human.
Exactly.
What keeps you going every day?
I have a great family. I have a great kids that always keep me inspired, and my wife, and I have a wonderful support network who are mostly nurses who we've stayed together via text and at work and bonded. And so having that important support system has been life-saving, literally, for me.